Today we'd like to talk about two alternative obturation techniques for root canal therapy, which are lateral condensation and warm vertical or continuous wave warm vertical condensation. We're going to start with the last part of this end of pilot is the Optura gun. This is a backfill gun. It squirts in warm plasticized gutta percha into as a backfill type of method. I always liken this to a Dairy Queen machine. Anyway, we'll go into our endo pilot, we'll go into obturation, and there is the backfill. We will turn it on here in a little bit, but I want to show you guys how to load all this stuff. This is the gun. It's got a little slot on the top of it, and we will load our gutta percha pellet. There's a plunger on the back that will help us load this pellet. And what you want to do, there's a little notch on the side that you'll see. You turn it counterclockwise. There's the notch, and it fits in here. You don't want to pull this plunger all the way out. What you want to do is just back it out a little bit, and then you will see a little slot in the blue piece of the plunger there. That's where we're going to load our gutta percha pellet, much like you would a rifle or a shotgun. So what I'm going to do, I'm going to take some gutta percha pellets. These are little pink pellets that you'll see. And these we'll load these into the Optura gun. Just like you would if you were loading a rifle or a shotgun. So now we're going to take our plunger, we're going to line up the notch, turn clockwise to lock it in, and then press our plunger down. We're also this is going to get very hot here, and we need to load the other end, and what we're going to load the other end with is a little needle tip. So we've undone the little nut there. We put a little needle tip into our holder, screw that back into the gun, and then this part is going to get very hot. So to protect the patient and your hands, we're going to put a little plastic sheath, and we're going to lock it in to our slot thusly. We will also, we don't like to go in straight on anything, so we can take our little needle tip, and using this device here, this little wrench, we can actually bend it. As such. And that's our Optura gun. Now we will turn on the heat. It takes a minute or so to heat up. We're gonna go low because we're working in plastic, and then we're ready to deliver this here in a little bit. As you can see on the block, the coronal third of this canal is quite wide and large. So we're going to talk about how do you backfill this? How do you fill this area and not just use paste? The first technique we're going to talk about is lateral condensation. So what I'm going to do first is I'm going to suction out the fluid, and then I'm going to set my master cone in, just like you've been doing in your class. I'll take my micro aspirator and just suction all that out for now, for the sake of demonstration. Now we got a fairly clean canal. I'm going to take my master cone, which in this case is a 4504, and I'm going to set it down into place, just like we've been talking. And you can kind of see all that space that's left. So how am I going to fill that space back up? I'm going to take these gutta percha accessory cones. These do not have a finite tip. They come to a point, just like a pencil point. They don't have a specified tip. And I'm just going to start to pack. And then I'm going to take my spreader, and remember there's two of these. They're single-ended. They look like explorers, but they're actually endodontic spreaders, and they're single-ended. And then I'm going to try to make some room with my spreader and just keep putting cones in there until I have filled that space. Maybe a couple of more. until I pretty much fill the space. And then I'm going to do what we've been doing. I'm going to take my downpack unit and I'm going to cut all the gutta percha out at once. And I'm going to take my time with this because I don't want to pull my master cone out. I'm going to touch that a little bit at the top, kind of get that part warm. And then I'm going to take my endodontic plugger. This is your double-ended instrument in your endodontic kit. There are three of these, and I'm going to condense the bolus of my gutta percha. Into my chamber. And you can see now we fill that space with gutta percha in lieu of sealer. Because I'm working on an acrylic block, I did not use any sealer. Now in here during your training and especially in the clinic, we do want to use sealer. People have asked me, do you put sealer on every gutta percha point you're placing? And the answer to that is it depends what kind of mood I'm in. Sometimes yes, sometimes no. I think once you get your first bolus of sealer in there, that should be adequate, but sometimes the sealer will also help in really big, wide, open canals in the coronal third. Thank you. Okay, the next alternative obturation technique we're going to talk about is warm vertical, or what I learned, continuous wave warm vertical condensation. Our master cone, as you can see, has already been placed. And this is a 3504, and you can see down in the last third of the apex is pretty well sealed. But as we proceed coronally, you can see that canal starts to open up a little bit more. So what I'm going to do now is I'm literally going to cut it off, just our master cone, just like you all have been doing. I usually go from the side. I'll make sure I'm cut off. And then I'm going to take one of my endodontic pluggers and I'm going to condense a little bit. I'm going to push it down as far as I can. As you can see, we got a pretty good fill here, but now we want to pick up maybe some little lateral canals, accessory canals, and we want to do this with warm gutta percha under hydrostatic pressure. So what I'm going to do now is I'm going to take my downpacking unit, and just like you all have been doing, after I've cut it off, now I'm going to change things a little bit. I'm going to take my downpacking unit and I'm going to plunge this into my cone. And I'm going to try to get about 4 millimeters from the apex. In doing so, I'm plasticizing this gutta percha and hopefully get it to fill, or get the sealer to fill some lateral canals. So here we go. And the way I learned is I'm going to let this thing heat for 4 seconds and as I plunge. So here we go. You'll hear the beep. So that's about 4 seconds. I'm going to let off the pedal and I'm going to let the gutta percha cool down. About 10 seconds. Okay, after about 10 seconds, I'm going to give the downpack unit a quick burst of heat, and then I'm gonna pull the plugger out. So I'm gonna give it a quick burst of heat, and I'm gonna pull it out. And that's exactly what I want. Then I'm gonna take my small endodonic plugger, because we were down pretty low now. I'm gonna take the smallest end, and I'm gonna condense, just like we did. I'm gonna try to condense that as well as I can. And now I'm going to backfill. So I'm going to take my Optura gun. It's already been heated up. I got 14 minutes to use it that we spoke about earlier. I'm going to put the needle down as far as it'll go. And I'm going to squeeze the trigger. And I'll keep squeezing until it engages that plasticized gutta percha. And if everything works correctly, this thing is going to slowly pull me out of the canal. You can see it starting to fill that coronal third. And it's slowly going to pull me out of the canal. And then I may touch this, since it's cooled down, with my heater again, with my downpacking unit. Just touch that a little bit. And then I'm going to take my bigger endodonic plugger and condense. And once again, you get a nice, dense fill of gutta percha. An acrylic block. I did.